Hello everyone. In this video we are going to discuss about pelvimetry. Now the word pelvimetry literally means to measure the pelvis. Now why we need to measure the pelvis? Just because it has got anthropological, radiological, obstetrical and medical importance. So here I have got a bony pelvis and we'll discuss about different measurements of the pelvis. Now we know pelvis is subdivided into the greater pelvis or false pelvis above and true pelvis or lesser pelvis below, and the line of demarcation is the pelvic inlet or pelvic brim. So this is the pelvic brim. Now how it is formed? So from behind forward, this is the sacral promontory, then comes the anterior margin of ala of sacrum, and here is the arcuate line up to iliopubic eminence. So here is the iliopubic eminence. This is the pecten pubis or pectinate line. Then comes pubic crest, and over here in the center this is pubic symphysis. So upper margin of pubic symphysis also contributes to form pelvic brim, and so as we have to continue to back to the sacral promontory. So this is a complete pelvic brim or pelvic inlet, and which divides the bony pelvis into false pelvis above and true pelvis below. So similar thing is described over here in this diagram. So this line is the pelvic brim or pelvic inlet, and again I am repeating, it starts from behind by sacral promontory, then comes anterior margin of ala, then this is the arcuate line, this is pecten pubis, then comes pubic crest, upper margin of pubic symphysis, again back to the pubic crest, pecten pubis, arcuate line, anterior margin of ala of sacrum and the sacral promontory. Now these three lines together are also termed as linea terminalis, like pubic crest, pecten pubis and arcuate line. So this is linea terminalis. So now we can say that the pelvic inlet is formed by sacral promontory, anterior margin of ala, linea terminalis, and upper margin of pubic symphysis. Again there is linea terminalis plus anterior margin of ala of sacrum and sacral promontory. So this is the line of demarcation. Above to that is the false pelvis, below to that is the true pelvis. Now regarding false pelvis or the greater pelvis, generally it is forming lowermost part of the abdomen, and two diameters are considered for the greater pelvis, like interspinous diameter, which is the distance between two anterior superior iliac spine, and generally it is around 25 centimeter. So this is the interspinous diameter, and second is intercristal diameter, that is between two iliac tubercles. So here this is iliac tubercle, over here also. So between these two iliac tubercle is the intercristal diameter, and that is bit more as compared to interspinous diameter. So that is 26 to 27.5 centimeter on an average in adult. Now let's talk about true pelvis or lesser pelvis. So first comes the pelvic inlet or pelvic brim. Now the plane of pelvic brim, just we imagine a plane passing through this pelvic brim in anatomical position. It is directed downward and forward like this, in such a way that if we hold the bony pelvis in anatomical position, so both the anterior superior iliac spine and pubic symphysis should be in a coronal plane. So obviously the plane of pelvic brim will direct downward and forward, and it will make at least 50 to 60 degree angle with the horizontal plane. Let me explain the same in a diagram. So here in this diagram you can see this is a sagittal section of pelvis showing pubic symphysis and the sacrum plus coccyx, and this is what we have discussed is this is the plane of pelvic brim or pelvic inlet, and this is directed downward and forward, and it is making 50 to 60 degree angle with the horizontal plane. Now if we draw a perpendicular imaginary line perpendicular to the plane of pelvic inlet like this, now this line is termed as axis of pelvic inlet. Now if we trace it above, then it will pass through the umbilicus, and below it will pass through middle of the coccyx, and this axis itself is coinciding with the long axis of the uterus. So this is regarding plane of pelvic inlet and axis of pelvic inlet. Now regarding taking measurements of the true pelvis, you know it has got three components: pelvic inlet, pelvic cavity and pelvic outlet. So for all these three components we are taking three measurements or three diameters: anteroposterior diameter, oblique and transverse diameter. So now let's see the measurements of pelvic inlet. Now first comes the anteroposterior diameter or anatomical conjugate of the pelvic inlet. So it extends from midpoint of sacral promontory behind to the upper margin of pubic symphysis. So these 2 points are considered to take the anatomical conjugate. Normally it is 10 cm in adult male and 10.5 to 11 cm in adult female. Now next comes is the oblique diameter. It extends from sacroiliac joint of one side to the iliopubic eminence of the opposite side. So these 2 points are considered to take this oblique diameter like this. And normally this diameter measures 11 cm in male, whereas 12 to 12.5 cm in female. Next is the transverse diameter. It is the widest measurement across the inlet and it measures about 12.5 cm in male and 13 cm in case of female. So for pelvic inlet, the transverse diameter is the widest diameter out of 3. So for pelvic inlet, first we have taken anatomical conjugate or anteroposterior diameter. Specifically for female pelvis, 3 more anteroposterior diameters are considered. They are also termed as conjugates, namely obstetrical conjugate, oblique conjugate and external conjugate. Let's see individually. So first comes is the obstetrical conjugate. Now this is considered from posterior surface of pubic symphysis to the midpoint of sacral promontory. Now the distance should be minimum. So a minimum distance from posterior surface of the pubic symphysis in front to the midpoint of sacral promontory. Now that will be the obstetrical conjugate. Now this is clinically very important just because this is the actual diameter the head of the baby has to traverse through during parturition. Now it is approximately 0.5 cm less than the anatomical conjugate. Second comes is diagonal conjugate, and that is considered from lower border of pubic symphysis in front to the midpoint of sacral promontory behind. Now this is also considered while doing pervaginal examination. So this is approximately 1.5 cm more than anatomical conjugate. So if we subtract 1.5 cm from diagonal conjugate after taking pervaginal examination, that will give us approximate anteroposterior diameter or anatomical conjugate. And third is the external conjugate. That is very crude measurement. It measures from external surface of pubic symphysis in front to the tip of fifth lumbar spine behind, and it also includes soft tissues and bone. So it is generally not considered in pelvimetry, but one can take this measurement to get approximate anatomical conjugate. So on an average it measures 19 cm external conjugate, and if we subtract 9 out of it, 9 cm, that will give on an average anatomical conjugate. So the same thing is explained in this diagram. Anatomical conjugate extends from midpoint of promontory behind to the upper margin of the pubic symphysis. The obstetrical conjugate is the minimum anteroposterior diameter from posterior aspect of pubic symphysis in front to the midpoint of sacral promontory, and diagonal conjugate extends from lower margin of pubic symphysis in front to the midpoint of sacral promontory behind, and external conjugate will be considered from outer aspect of pubic symphysis in front to the tip of fifth lumbar spine behind, and that is including soft tissues as well as bone. So this is regarding measurement of pelvic inlet. Now when you see it from above, you can clearly make out that shape of the pelvic brim or pelvic inlet is looking like a heart of playing card. Now accordingly, the female pelvis is subdivided into 4 subcategories. So according to the shape of the pelvic inlet, it can be gynecoid, android, anthropoid or platyploid. Let's understand it in a diagram. So here in this diagram you can see 4 subtypes of the female pelvis are observed according to the shape of the pelvic inlet, like android, gynecoid, anthropoid and platyploid. Now first let's see the android type of the female pelvis. Now as we have discussed, the shape resembles conventional heart of playing cards because the sacral promontory, which will be situated somewhere over here, this is posterior, this is anterior. So the sacral promontory projects much forward, and the posterior segment, this will be the posterior segment, this will be the anterior segment. So the posterior segment is wider as compared to the anterior segment. Now a significant number of females are possessing this type of the pelvis, and this will lead to cephalopelvic disproportion during the time of parturition. Next comes is the gynecoid type of the female pelvis. The shape is rounded and the transverse diameter being widest. Both the anterior and posterior segments of the inlet are significantly wide. Now it is stated that not more than 50% of female pelvis belong to this category. But whenever this type of the female pelvis is observed, it will not lead to much difficulty in parturition. So over here the cephalopelvic disproportion is not observed. But still one has to consider other points like size of fetal head and interspinous diameter. Now third type of the pelvis is anthropoid. Here the anteroposterior diameter is more than the transverse diameter and the shape is sagittally oval. This is horizontally oval, this is sagittally oval. The pelvic inlet of neonates of both the sexes, they are anthropoid in shape, and generally such shapes may be retained in adult Negro females in some races, but this is very less frequently observed in adult females. The fourth subcategory is platyploid type. This is also known as flat pelvis and this is generally observed in osteomalacia or rickets. Now this happens due to deficiency of vitamin D and this will lead to disproportionately wider transverse diameter as compared to the anteroposterior diameter. So this is regarding classification of female pelvis as per the shape of pelvic inlet. Now second component of lesser pelvis is pelvic cavity. Now that is directed downward and backward. So if you see it in anatomical position, this is the plane of pelvic inlet and deep to it will be the pelvic cavity, which is wider behind and narrower in front, and just see the direction of it downward and backward. So posteriorly it is bounded by pelvic surface of sacrum and coccyx. Lateral it is bounded by pelvic surface of ilium and ischium, and in front it is bounded by posterior aspect of pubic symphysis, body of pubis and its two rami. Now to understand pelvic cavity of male and female, let's see this diagram. So here you can clearly see that the pelvic cavity of male is longer and more conical, whereas the pelvic cavity of female is shorter and almost cylindrical. So the diameters of pelvic inlet and pelvic outlet are almost similar, not much difference between these two diameters, but over here you can clearly see that the diameter of pelvic inlet and pelvic outlet are much more different. Okay, so the difference is more over here as compared to the female pelvis. So it is said that the pelvic cavity of male is a longer section of short cone. This is short cone, this is long cone. So pelvic cavity of male is longer section of a short cone, whereas pelvic cavity of female pelvis is shorter section of a long cone. So the diameters are almost similar and the cavity is cylindrical. Here the diameters are different and cavity is conical. So the same thing is observed in terms of taking subpubic angle. So this is subpubic angle and it is 50 to 60 degree in case of male, whereas it is wider and 80 to 90 degree in case of female because the pelvic cavity is more roomy. So the same thing you can understand in this diagram. So here is the subpubic angle. So as I mentioned, it is 50 to 60 degree in case of male, whereas 80 to 90 degree in case of female. So it is more wider and it is more cylindrical, it is narrower and it is conical. Now let's see measurement of pelvic cavity. Now these measurements are having special importance for obstetric purpose. First comes the anteroposterior diameter. So it is the distance between middle of the back of pubic symphysis in front to the center of the body of S3 behind. Okay, now these 2 points are considered, and on an average in case of adult female the distance is 13 cm. Generally the dimensions are considered for adult female for obstetric purpose. Now next is oblique diameter. So posteriorly the lower margin of sacroiliac joint is considered. That is the first point, and second point is midpoint of obturator membrane, which will be filling obturator foramen somewhere over here. So midpoint of obturator membrane of opposite side. So these 2 points are considered for taking oblique diameter, and that is approximately 13.1 cm in case of adult female. So that is larger than anteroposterior diameter. Third is transverse diameter, that is widest diameter between the body walls of pelvic cavity over here. between the pelvic surfaces of ileum and ischium, and that measures approximately 12.5 cm in adult female. So out of 3 diameters, the oblique diameter is widest. Now apart from these 3 diameters, specifically in pelvic cavity, one more dimension is considered, and that is a plane between two ischial spines. Now this is termed as plane of least dimension, where the transverse diameter of pelvic cavity is narrowest. So most obstructed labor take place at this level. These two are ischial spines, and over here passes plane of least dimension. Now finally comes the pelvic outlet. It is said that shape of pelvic outlet is diamond shape. So these two are ischial tuberosity, and these are the lower margin of sacrum, and over here will be the coccyx. So if we consider sacrotuberous ligament over here between ischial tuberosity and lower part of the sacrum like this, and if we see it from below, so you can now imagine the shape of pelvic outlet, which is diamond shape, which is bounded in front by lower margin of pubic symphysis, which is covered by arcuate pubic ligament, anterolaterally by lower margin of conjoint ischiopubic rami, laterally by ischial tuberosities, posterolaterally by sacrotuberous ligament, and most posteriorly by tip of the coccyx. So these are the boundaries of pelvic outlet. Now when we hold this pelvis in anatomical position like this, and when we try to imagine plane of pelvic outlet which extends from tip of coccyx behind to the lower margin of pubic symphysis in front, somewhere over here. This is tip of the sacrum, and below to it will be the coccyx. So if we keep a bit distance from tip of the sacrum like this, so this will be the plane of pelvic outlet, and when we trace it forward, it will make 10 to 15 degree angle with horizontal plane. Let me explain the same in diagram. So again the same diagram, that is what we have discussed for plane of pelvic inlet, which is showing pelvis in saddle section. So here you will have to imagine tip of the coccyx behind, and this will be the lower margin of pubic symphysis. So this will be the plane of pelvic outlet, which is making 10 to 15 degree angle with the horizontal plane, instead of 50 to 60 degree angle which is formed by plane of pelvic. Now when we imagine a perpendicular line passing from center of pelvic outlet, and if we trace above, it will touch center of sacral promontory, and this is termed as axis of pelvic outlet, which will coincide with long axis of the vagina. So this is the axis of pelvic inlet, which will coincide with long axis of the uterus, whereas the axis of pelvic outlet will coincide with long axis of the vagina. Now let's see measurements of pelvic outlet. So first comes the anteroposterior diameter. So anteriorly it is considered from lower margin of pubic symphysis and posteriorly to the tip of the coccyx, or sometimes to tip of the sacrum, because coccyx is more mobile in case of female. So these 2 points are considered to take anteroposterior diameter of pelvic outlet, and it measures 12.5 cm in female and 8 cm in case of male. Next is oblique diameter, and for that you will have to imagine sacrotuberous ligament somewhere over here like this. So one point in front is considered as junction of ischiopubic ramus somewhere over here in front to the midpoint of sacrotuberous ligament behind. So this will be the oblique diameter, and it measures 11.8 cm in case of female and 10 cm in case of male. Third is transverse diameter. So the points considered are medial surfaces of lower end of ischial tuberosities over here. So between these 2 points will be the transverse diameter, and it measures approximately 11.8 cm in case of female and 8.5 cm in case of males. So when you consider all the 3 diameters for pelvic outlet, the anteroposterior diameter is longest. Now considering all the diameters of pelvic inlet, cavity and outlet, the transverse diameter of inlet, oblique diameter of cavity and anteroposterior diameter of pelvic outlet are longest, and in normal act of parturition, the suboccipitobregmatic diameter of fetal head will fix first with the transverse diameter of pelvic inlet, and then it will descend spirally by engaging with oblique diameter of pelvic cavity and anteroposterior diameter of pelvic outlet. So this is how the head will descend spirally, and it rotates to accommodate the maximum diameters or longest diameters of cavity and outlet. Now between plane of pelvic inlet and plane of pelvic outlet, we can draw multiple planes and this will become plane of pelvic cavity. Okay, multiple planes can be drawn. Now if we join center of these planes, that will become axis of pelvic cavity with concavity facing forward. Now the head of the fetus during parturition will have to traverse along this axis of pelvic cavity. So it is also termed as axis of birth canal. Now this axis of pelvic cavity in upper part coincides with axis of pelvic inlet up to the level of ischial spine. So head will have to descend backward and downward up to the ischial spine, and then the axis of pelvic cavity will change its direction to downward and forward coinciding with the axis of vaginal canal. So then the head will have to change its position to downward and forward. So this is regarding pelvimetry. Hope you have understood well. Thanks for watching.